am Dr. Amy Jennings, Assistant Professor here at PNWU's School of Occupational Therapy. It might sound a bit cliche, but I entered OT to help people. I wanted to have a rewarding career where I was really making a difference in people's lives, and occupational therapy certainly does that. Occupational therapists can work in a variety of settings. My setting has primarily been outpatient rehab. I work with people who have brain conditions, so a lot of stroke, brain injury, multiple sclerosis, Parkinson's disease. And we together set a plan and goals on what they want to work on most. Physical rehab, cognitive rehab, even emotional and psychological well-being, kind of a really big whole picture. Defining moment for me is I was working as an occupational therapist in neurorehabilitation, and then myself one day woke up in a dark room, hearing the dull hum of machines, hearing this distant beep, beep, beep. At this point, I realized that I am in a hospital bed. I'm in the hospital where I work, but with no recollection of what has happened. Eventually, I came to learn that my husband woke up in the middle of the night to me having a grand mal tonic-clonic seizure, and I was 35 weeks pregnant, so almost full term. But they rushed me to the hospital and induced labor. Eventually, we came to learn that I had a cavernous malformation in my brain. It was just behind my left eye, something we didn't know I had previously had. And I was discharged from the hospital as a new mom with a baby I didn't remember having. With a new neurological diagnosis I needed to learn how to navigate, and with a scheduled craniotomy. My own health experience really changed the way that I approach patients when I am working with them, especially when they're experiencing frustration. I'll have people get really sometimes upset or just frustrated, and they look at me like I have no idea what they're going through. But then I can share my story with them, and it completely changes the effort that they put into the therapy, knowing that I've been there too, and my story might be different, but I do know a little bit about where they're coming from, and then together we're able to help navigate this new path forward. OTs build relationships because it's not just what we do, but it's who we are. And it's really part of our personality and part of our identity to be an occupational therapist. But we use that relationship to help someone improve and highlight in their own life what they want to work on and achieve those goals. Qualities well-suited in occupational therapy, really someone who wants that human connection. We want to work with people and really make a difference in their lives. Another big piece is creativity. Individualize every single treatment session to who our client is, and that looks different depending on who you are. The occupational therapy program here at PNWU it's very hands-on with our learning and very individualized to students. So it's a small student to professor ratio, but we can really capitalize on that and help individual learning and growth. I think the mission of serving rural and underserved populations is also very strong and something that our profession and our nation needs more than anything. Most of our people have limited access to health care, which we do need to advocate for change, but at PNWU we are helping students be a part of that change.